Council.
This meeting is being recorded.
Okay, very good. And I'd just like to give everyone a chance to go around and introduce themselves if they'd like to.
And drop your information in the group chat, please.
Okay, I guess I'll start off. Again, William Long. I'm a peer recovery support specialist for Family Treatment Court in McDowell County. I work out of the Alternative Sentencing Program office in Welch. And last month, we were asked to invite somebody that was justice affected to this month's meeting. And all the people that I work with are justice affected, and I have a few of them with me today. And I'd like for any of them that would like to come up and introduce themselves, tell everybody a little bit about themselves. Anybody wish to?
Hello, my name is Carla Phillips, and I work here as a peer coach at the McDowell County Day Report, and I also work with the drug court as well. And is it affected by drug addiction? Is that what it is? Is that being affected by addiction?
Well, affected by justice affected, like having experiences with the justice system, with the legal system.
Yeah, well, I've had experiences myself. I actually was years ago. I guess it was probably about in 2004. When I was in the madness, I was arrested on a conspiracy charge. Me and my ex-husband selling dope, and I got arrested, and I got a 1 to 5. So I did 14 months. I did a year. I got 1 to 5. Did 14 months, and was actually released. And from there, I went through parole myself and made it through. At that time, they didn't have peer coaches or anything like this. I think they was just starting Day Report, to be honest with you. It wasn't there wasn't a lot to help in recovery. But so today, me being able to actually work in the justice field and being able to help people to have alternative sentencing and diversion of incarceration, it means a lot to me. And thank you.
Anybody else like to introduce themselves?
So my name is JJ. I'm doing my PRSS training here with McDowell County Alternative Sentencing. I've had plenty of run-ins with the legal system and all that. My charges were third offense driving revoke and possession with intent. I'm coming up on my 2-year mark in September to where I can test for the state to get my certification, but I'm just filling out a new job and and learning how to get back to to the community that I really poisoned for years. So that's my life today.
You want to share? Or no? Okay. If anybody else would like to introduce themselves that's on the call, feel free to.
Hi, my name is Terry Castle. I'm the newest member of the REACH Initiative. I am justice impacted as well. I have recently got a job with the REACH Initiative, which changed my life. It's doing what I love, and I'm 3 years out of prison almost, so this is a big deal. Aaliyah?
Hello, my name is Leah Tanner. I work for Disability Rights of West Virginia. We are the federally mandated protection and advocacy group for people with disabilities. We have advocates that go into the correctional facilities, mental health facilities, foster, you name it. They do monitoring. We also do individual advocacy if someone calls us and gets complaints, saying that they're not getting their medical treatments, things like that. I put our website as well as our phone number and my email in the chat. I would recommend anybody, whether they're going through reentry or anything, going to our website if they have a disability or if they know someone who has a disability. There's a lot of self-advocacy tools on our website. And then of course there's also an email that you can email if you don't want to email me personally. If a good rule of thumb is if it has to do with a disability, we probably have something to do with it. Do you want me to call on somebody or you want me to wait to volunteer?
Don't matter.
I'm gonna pick on Seth.
Yeah.
There you go.
Why does everybody pick on me? No, I'm just kidding. Hey, everybody, Seth Hansen with Groups Recover Together. I'm actually the Partnership Development Manager for the state of West Virginia. Groups is an outpatient opioid use disorder treatment program with 7 locations in the state. We offer a hybrid model as well to open up access to as many people as possible for treatment. So thanks for having me, and I'll kick it over to Adam.
My name's Adam Short. I work with First Choice Services. I'm the outreach coordinator. I'll be doing a presentation here shortly about our program, so I won't get into all that right now, but we do cover a wide variety of different topics. I help set up a lot of our outreach that we do across the state. We operate in all 55 counties, so if there's ever a situation that you would like us to be a part of, or if you need additional resources, you can always feel free to reach out to me.
Thank you.
Thank you, everyone, for your introductions. And if nobody has anything else, I guess we can allow Adam to make his presentation now.
All right.
Do you need screen share capabilities?
Well, I was gonna see. I might be able to do that. Can y'all see that all right?
Yeah.
Okay. All right. So we'll kind of go through some of our programs. This is just a little bit about us. We started back in 1999. There were about 25 employees. This statistic's a little bit off because we just had a new grant. So we're well over 200 employees now at this point. And we just add an additional program as well. But we are a second chance employer. As you can see here, more than half of our employees are in long-term recovery. So we are proud of that, and we have a great workforce, great leadership. So we're very, very proud of what all we are able to accomplish here. So the first program we'll talk about is our 1-800-GAMBLER. This program, unlike a lot of grant funded programs, is actually funded through the West Virginia Lottery. So it's actually our most well-funded program. As a result, we're able to offer a lot of different services. So if you know someone that has, issues with gambling, they want to reduce gambling or they want to quit gambling, they can always reach out to us. And what this program does, not only does it hook them up with therapy services, but it also allows them to get additional help that they need. So we can actually send them software that will block gambling websites on their computer. There's an app that will block it on your phone. We can ban you from the big 5 casinos here in the state. Later this week, they're doing a retreat. They do these retreats a couple times a year for people that are in this program. And basically, they teach them coping skills. They kind of bond together. It's a really great program. We just hired some peers, which was a new addition to that program this year. So we're going to have peers on staff for our 1-800-GAMBLER. And typically when I go out places, this is the one that people always joke about the most. You know, people see the pamphlets and they're like, ah, my Aunt Sue, she really needs this. She's got a problem with gambling. But the problem it is that even though people do like to joke about it, it's usually the one that affects people the most. So usually by the time they reach out to us, they're in a really bad situation. So people aren't just going to call because they've got a little bit of an issue. And the thing that we're seeing now is an uptick in youth gambling, whether it be through like loot boxes, through video games or sports gambling. We're starting to see this more and more, and it's kind of like with substance use. The younger you get started, the more likely you are to develop a long-term addiction. So, these youth are getting involved thinking it's kind of a harmless thing, when in reality, that's something else that we're going to have to deal with, in the future. So, if you have issues with that in communities, we try to talk to our schools and stuff about this as well. Just the seriousness of it, about how important it is to talk to the youth about gambling, because if we can, we're not allowed to say we're pro gambling or anti gambling, but responsibly gambling, if it's taught at an early age, then it's less likely to be a factor as they get older. But it's just important to be able to get that message out there. So, like I said, it's a great program, um, and they do a lot of wonderful things, and they're continuing to expand services as well. So, we'll probably have some more information about that later this year. So, our next program is our Help for West Virginia. This program here was developed in partnership with the DHHR during our opioid crisis. There was a significant need to kind of pool resources to be able to help individuals. Um, Even a few years ago, if you were to call and try to get into a treatment facility, you usually had a wait list, right? And that wait list sometimes would be a few days, but most of the time it was more like a couple weeks and to get into a facility. And what happens in that time frame? People decide they no longer want to go to treatment, right? So they initially apply, I want to go get help, I want to get treatment, but then a couple weeks pass and now things have changed. So what we offer through Help for West Virginia is the ability to be able to get into treatment within 24 hours. We're able to get you into a treatment facility in a bed, arrange transportation, help with insurance issues, have all that taken care of, and get you there within 24 hours. If you want outpatient treatment, we can set that up as well, usually through like a virtual visit, through telehealth. But we do have lots of things across our state, and doesn't necessarily mean that you'll be in the county that you live in. But we have to go where there's a bed available. So, but we can arrange all that as part of this program. As you can see here, we take about 25,000 helpline calls, text, chat per year. That's continuing to increase. We've seen a significant increase in it this year, um, of people trying to get into treatment. I go and speak to audiences all across the state. I was at a DHHR the other day, and the lady told me that as part of a CPS case that she was working with, the mom has been waiting for over a month to get into treatment because they were so backlogged. And I'm like, okay, tell her to call this number and we'll do it today. Like, we'll make it happen. And it's such a game changer, especially for substance use, mental health, to be able to get the help that you need immediately, and to not only feel like that people are concerned about your well-being, but the fact that like we can make it happen that quick. And um, I've worked in behavioral health for quite a while now, and you can't force anybody to go into recovery. I mean, they can go through the program, but it doesn't necessarily mean it's going to take effect. But when someone is ready to go through the recovery process, they're ready to go, and so we want to make sure that they have that availability. Um, so again, here are some of the programs available through Help for West Virginia. Um, again, this is mental health and substance use, psychiatric care, withdrawal management. We also have peers on staff as well, that can help individuals that are in early recovery, or maybe sustained recovery. that they can actually call and talk to our peers. And sometimes it's just like, hey, I'm really having a difficult time with this. Can I just talk to you? And because they've been through this, um, we see that it's really helpful for people to be able to talk to someone with lived experience. And due to the fact that we are a second chance employer, there's a good chance if you call on that line, you're probably going to talk to someone who's in recovery. So I think it kind of makes it a little more like realistic for people that they're talking to people that have already been through this. So, but that is our adult helpline. And if you call that same number and you press prompt number 2, you're going to get our children's crisis line. Again, this is another program that has been set up through uh, the uh, the DHHR. And what we saw before is that when children had a lot of emotional health issues, that they would have to be transferred out of state. So we were seeing kids that were being sent out of state for treatment, and the state was actually paying other states to be able to treat the kids here in West Virginia. So, it became really a big issue, funding wise. And so this kind of came as a result of that. And what the purpose of the Children's Crisis Line is that we kind of pull different resources available to us through like the Children's Crisis mobile that operate in different areas across our state, and also with the wraparound services and the CSED waivers that are available through the state. And what we do is we initially start this process of either contacting um, the mobile crisis unit to come out to where the child's at. It could be their home, it could be the hospital, it could be a school. And they'll come out there and they'll talk with the child. They'll do like an initial kind of intake, see what services that child needs and what we can do to help that child. Because the idea is to keep them in the home, but make them successful where they're at. So we want them to be able to get the help they need without having to go away from home. So these supports are available for that. And if they get enrolled into the wraparound services, typically those workers have like 5 kids per caseload. So usually that means they can manage it pretty well and be able to keep up with their client load. They usually are supposed to check in with the child about once a week just to see how things are going, see if they need anything. So, um, it's a great program. We're still working out some kinks, partially because we have so many rural areas that aren't necessarily covered by providers, or the providers in those areas are overwhelmed with cases. So we're still trying to work through that, but it's continually getting better. So I've already kind of touched on our peers here. One of the other things that our peers do as well is they're active in our QRT. They also uh, call around to check and do follow-ups for individuals. And of course, I use them a lot when we do our outreach services um, in different places, and they're able to go out there and kind of share their story, which is always awesome. We do a lot of recovery events. So the next is Tobacco Quit Line. This program here, if your insurance does not offer a tobacco cessation program, we'll actually pay for your treatment. So we'll send you the patches, the gum, the lozenges for free. It's like a 15-minute initial intake with someone, and then at that point they'll set you up to receive that stuff in the mail. So most people do not have that. I think there's only 2 in the state, and one of them is PEIA that has their own cessation program, but most people don't have a cessation program on their insurance. So if they call in, they're like, I want to quit smoking or rubbing, then they'll actually do this little intake. And once the intake is complete, they'll ship that out to them, and they're able to get that. We also have access to therapy as well, if they want additional help with that. And our call line individuals that answer it act as our coaches. So um, people can call back in like, hey, I think I need additional resources. We can help them with that as well. And, again, these programs are absolutely free. So if you know someone who needs this help, you can feel free to reach out to us. And we'd love to be able to help people. So the next is our 211, which is not really our program, but we do answer the calls for United Way on their off hours. So once they leave the office or if they have too many calls, we act as an overflow because it is a 24/7 program. So once they log out, we start answering the phones for them and the calls and the text. There's over 10,000 different resources available through 211. It's amazing when I go places and people have never heard of 211 before. Uh, I guess because I've worked in it for so long, I just assume that everybody knows that these resources are available. But I talked to a DHHR the other day, and they're like, "So what does 211 do?" I'm like, well, if someone barely misses the window for getting help with their utility bill through the DHHR, they can probably just call 211 and they've probably got resources available. And they were like just dumbfounded about that something like this existed. But 211 has been around for a long time. And during COVID, um, we really saw an uptick in calls of individuals that need help. So not only do they help with like utility bills, they'll help with food, they'll help with transportation issues, even help with education. So if you've got a need, it's worth at least checking 211 to see if it's something that they can help you with. They're continuing to expand. Um, they've got a great deal of buy-in from religious organizations right now, and so they're kind of coming together too. So we're all kind of pulling together some resources through 211, which I think is awesome. The next is Jobs and Hope, which is again, it's not our program, but we do answer the phones for Jobs and Hope. Um, so originally, this was designed in mind for people with substance use disorder that had barriers to getting employment, and it was to basically help them find jobs, get job training, um, which they still do that as well. But they've now expanded it out to anyone who has a barrier to getting employment. So it could be mental health related as well as substance use. Um, So, they do lots of different things with Jobs and Hope, but the most important thing to kind of take away from it is the education part of it because that's a huge part of this program. Um, I can't tell you how many people I've talked to out in the public about it, and they've heard that Jobs and Hope gives away cars. Okay, that's part of it, but that's not the only thing they do. You have to be part of the program, which means that there's steps that you have to take. And if you have someone that you're working with that is enrolled in Jobs and Hope and you have an issue, you can always feel free to reach out to us. We might be able to have some kind of like back channel way to figure out what's going on. Because I've had people out, like I had someone enrolled in the program and now their transition agent won't call them back. And come find out the transition agent left, notes didn't get passed on. Stuff does happen. So we don't want people to fall through the cracks. So if you have an issue like that, you can feel free to reach out to us and we can go and try to figure things out. And typically we can get it resolved pretty quickly. So once we know what's going on, but as you can see here, that as of the date of January 2023, there were 386 Jobs and Hope graduates. It's now more than that. 11 of our employees here at First Choice have actually graduated through this program. You see the average annual salary of participants is around $32,000. If you think about someone who was not able to find employment and now they're making $32,000 a year, that's got to be a big relief for people. And so we're seeing more and more individuals kind of gravitate towards this, and it's a great program to be able to utilize. And they've done a lot of great work, especially on the transportation part of it, being able to provide people access to get the jobs, get the treatment, and also working to build a relationship with employers to allow individuals to go to meetings. Um, and all that. That's really supportive. So I think that's an awesome thing. The next is our West Virginia Navigator program, which is our health insurance line. We are not agents, so we don't sell you insurance, but what we do is we kind of go through the Affordable Care Act to see what you qualify for. So we start talking about the Affordable Care Act. Initially, every time I go somewhere and I start talking about it, they're like, "Oh, Obamacare." Yeah, it is Obamacare, but it's a lot different than when it first started. So what we've seen now is that there are lots of different subsidies in place. The coverages are increased. They've made a lot of positive changes to the program. One of the most positive things I think that come out of it is that if someone has a pre-existing condition, they're not excluded from coverage. It doesn't ask you any questions about your health. So when you're signing up for health insurance through the marketplace, they don't ask you any health related questions. 4 out of 5 people in this state are going to qualify for a plan that's $10 or less a month. And the thing about that is that this is like Blue Cross Blue Shield and Care Source. So they're good quality insurance programs. We can actually go through and see if your doctors are in network. We can see if your medication is covered under that insurance. So you're not just signing up for something that you're not going to be able to use. So it is a great program, but we also can check to see if you requalify for Medicaid, and we can do that Medicaid application for you. The Medicaid unwind started happening last year, and we saw a lot of West Virginians lose health insurance coverage, and they didn't requalify because during the time of COVID, they weren't allowed to be kicked off of Medicaid. So now that those rules have changed, people have lost Medicaid coverage, and I've had people that were like just outside the window of getting Medicaid, like by a couple $100, and they've got plans that are $0 a month premiums, $0 deductibles, $1 copays to go to the doctor. I mean, better insurance than I have. So I mean, when people talk about like, oh, I don't want some junky insurance, it's not junky insurance. It's really good insurance. And they're continuing to expand it, and each one of those programs have their own benefits too, as far as Care Source and Blue Cross Blue Shield, and we can talk to individuals about that when they call. Um, but West Virginia has really utilized this past year, and we've continued to see our rate of uninsured individuals in the state decrease, which I think is awesome. And we had more people sign up per capita than any other state in the union this past year. So that's good that people are actually utilizing these services. The final thing here is our 988 line. Now, a lot of people think of it as just the suicide hotline, but it's also our crisis line as well. So if you're someone or you have someone that is just in crisis, or they're really going through a rough time, they just want someone to talk to, they can actually call, text, or they can go online and chat. Now, the cool thing about going online and chatting, especially with like younger people, is that they can chat anonymously. So they don't even have to give their name or any information about it. And they might feel more comfortable sharing that way. So that's definitely an option for them. And really, this line here is designed to be able to help people de-escalate situations, to kind of um, you know maybe kind of talk them down a little bit, to be able to help them, encourage them. And that's what those people are there for. They're all certified crisis counselors. So when you call and talk to someone, you're talking to someone who has been through training. They've been through the assist training and they've been through safe talk. They're well prepared to have these conversations. And not only do we have the grant for the state, we also have the National Backup Center here in Charleston as well. So if you call our 988 while you're here in the state, there's like a 96% chance you're going to talk to somebody from West Virginia, because we have one of the highest rates of answer in the country. So more than likely, they're going to talk to somebody from West Virginia. This is a 24/7 program, so there's always someone available to be able to talk to you. And we saw a continuation of this grant because they've expanded it to allow us to do 6-month follow-ups with individuals. So let's say that you call the hotline, you agree to have a 6-month follow-up. Over the next 6 months, we'll call and check in periodically and just to see how you're doing. Because you may say, you know what, I think I'm ready to go to therapy now. And we can actually help you with that. We can help you get set up with therapy services. Or I feel like I need to get some medication. We can help you get set up with medicated treatment. So um, with med services. So there's lots of stuff available through that program, which is really awesome. Great people to be able to talk to. I mean, we have some individuals that just call because they're lonely, especially during COVID. We saw calls triple during COVID because people were lonely, they were separated, and they needed that human contact, and so people would call just to talk. And they're available for that. So, if you think, well, it might be too dumb or I might, I'm just going to bother these people, you're not bothering us. We want you to be able to call because this resource is available to everyone. So, and then this is a new program that's being rolled out. It's not officially had its big rollout yet, but we're working on that right now, which is our CIT program. It's actually through the 988. But this program actually is going to train law enforcement and first responders to be able to de-escalate situations. Uh, this is based on a national model, and this national model has actually seen a decrease in officer-related shootings. It has seen a decrease in individuals that have escalated situations with law enforcement, and it's kind of like a if you ever have like a hostage situation and they call in the hostage negotiator, well, this is kind of like what CIT does. So that there's specifically groups of or teams that are part of this program that will actually come along and during a mental health crisis, whereas officers right now, in a typical situation, would respond by arresting the individual, taking them to jail, and all that has done is create another barrier for these individuals. So now we're going to partner with our different mental health providers all across our state to be able to contact and be like, hey, I've got this individual, they're in crisis right now, so let's come together, resolve this issue, get them the help that they need. So, what a difference that this would have made even just in a couple of years ago, and seeing the way that law enforcement responds to individuals during a mental health crisis, is definitely lacking. So, uh, the goal is to be able to do this in every law enforcement agency in the state of West Virginia. And in cooperation with that, the State Police Academy is going to start teaching emotional intelligence, which I think is really awesome because it kind of goes hand in hand with what we're trying to do with our crisis intervention team. That's not something that people probably ever thought that we would be teaching our law enforcement academy, but I think it's really crucial, especially as we see, an increase in mental health related issues. So we'll see a big rollout on this soon. They're going to be doing a bunch of press and stuff on that. So they'll release all that here real soon. But they're real proud of our logo, so I thought I would show it. And like I said, they'll be rolling out more information in the next probably couple weeks. So, but that's all of our programs. If anybody has specific questions, you can feel free to ask me, or if you want to wait till later, you can always reach out and email me or call me. So.
Thank you, Adam, for the presentation. I will just say, as a PRSS, first responder services have definitely been beneficial to me, allowing me to do my job, especially help for West Virginia, help for WV. I've been able to use that program, use that call line to help a few people get into treatment. So definitely grateful for that. But thank you again, Adam, for your presentation. At this time, I'd like to turn it back over to Reentry Councils.
Right, well, thank you, Adam, for all the different things, and I even learned something. I mean, I didn't know you guys answered phones for Jobs and Hope and for 211. So, and the reentry councils are in reach are on 211. So I personally have had a hard time finding them on there, but apparently, maybe hopefully you guys can see them on there, Adam, from your side. So, but that's I appreciate you guys for sharing that. The only other thing I have, and then I'll turn it over to you, Cody, before I bolt out of here, but tomorrow Bev and I will be at Concord University, so if anybody wants to stop by and go through the reentry simulation, we will be there. I dropped the flyer over in the chat, so if you've never been through a reentry simulation, come and see us. It's a very eye-opening experience. I mean, we give you an identity, and you have to go through. You have a task list that you have to complete within 15 minutes equals 1 week. So you have to complete your full month of everything from getting your IDs to seeing your probation officer to drug court to drug testing, everything you have to do for real life. And then I might walk up and go, and here's your kid, congratulations, you got your babies back. And you got to lug it around because you can't afford daycare. And so it is very real. You may get your 4-3 forms of identification. You may get some money. You may get some bus tokens. So you have physical things to carry around with you and tasks you have to complete within this 1 hour or 1 month to keep you from going back to jail. So we're doing it for the students, but if any of you want to stop by, we'd love to see you. All right. Cody, I'm going to turn it back to you. Gary, you've got, but the rest of you, I'll see y'all later.
Bye.
Thank you. And I guess I don't have anything else unless anybody has anything else. We'll meet next May 21st at 10 a.m. So until then, hope you all do well. Have a great month, and we'll see you next month.
Bye.
Thanks.